Heidi ho! It's me again, Dr. Kate Sage. And today I wanted to talk to you about ear infections. I know I promised you a video of my favorite things to give children for when they have ear infections. So here it is, finally. Here we go. First of all, let's start with things that you can give them orally, because as you know, they have a viral infection or a bacterial infection anyway. And so taking things orally will just help their immune system to fight whatever is inside their ears growing. A few things that I like to recommend when kids are feeling ill. The first one would be zinc. As you know, zinc is a mineral that also helps boost the immune system. It's not something that kids should take every day all the time because it can cause an imbalance of different minerals. But taking zinc while they're sick is a great thing to do. And usually the daily dose for this is between 5 milligrams and 15 milligrams daily for when they're sick. The second thing to do would be vitamin C. Vitamin C is a great and potent antioxidant, which means it likes to kill all the oxidants, aka things like viruses and bacteria and anything else that wants to cause our body damage. So taking vitamin C when your child is sick is another great way to help fight the bad guys. We like to do vitamin C to the point where they say bowel tolerance. So that means a lot of it. It means to the point where they get loose stools, and then you back off a little bit. So if your kid starts getting diarrhea at like 2,000 milligrams, then you start giving them 1,500 milligrams a day when they're sick. And that should help to maximize their immune system and make them feel better, pretty snappy. The third thing you can consider giving them, especially for ear infections, is the probiotic that has been specially designed for ear infections, specially designed or specially researched for anything that has to do with face infections. So like teeth and sinus and ears, this probiotic is great for those things. So what is it? Streptococcus salivarius. So there are definitely some blends out there for kids that have the Streptococcus salivarius in it. And it can help not only treat ear infections, but can also prevent ear infections. It's also really good for your teeth. It can prevent sinus infections. So taking that particular probiotic regularly is a really good thing to do, especially if your kid has recurring ear infections. So then there are more things that we can do also just to help with the pain and to help actually in the ear. So the other things that I like to recommend is to do the garlic mullein ear drops. I'll show you a recipe for that, but you can also get this at most natural food stores, the garlic mullein drops. Sometimes it has a couple other herbs in it too that can help reduce pain and help with the infection. A really important piece though is before you put anything in your kid's ear, you should make sure that it has not ruptured. Sometimes parents don't know whether or not their kid's ear has ruptured. Occasionally it will show up as the kid's ear they heard a loud pop and then all of a sudden they feel better, in which case you know that it ruptured. But sometimes that doesn't happen and parents have no idea. So really, if your kid's eardrum has a hole in it, we don't want to put anything in their ear. A really good way to know whether or not they have had a rupture is to just go ahead and get your own otoscope. I talk about that in a different video, which you can check out over here. But so if you are going to do the garlic mullein ear drops, I usually recommend to do 5 drops in both ears 3 times a day. And the reason we do both ears is because oftentimes ear infections spread from one ear to the next ear. So 5 drops, both ears, twice a day. You can warm it up and that makes it really nice, especially for pain. A second thing you can do is the onion earmuffs. That's a whole different video too. Look here, you can push that button and learn all about it. That's a fun thing to do with onions, putting them directly against their ears, and it can help take all the pain away and also helps with the infection. And then the third thing you can consider is also putting colloidal silver drops in your child's ear. 2 to 3 drops. Again, I would do both ears, and again, make sure that their eardrums have not ruptured before you put anything in there. All right, that is just kind of top of the list, first things I normally recommend. If you have questions or any comments, please let me know down below, and I would be honored if you would subscribe to my channel. Thanks for watching.